welcome back to Grow and Glow with Dr. Tommy, your safe space for building unshakable self-love, growing healthy self-esteem, and living a whole authentic life. All right, today I want to talk about what happens during a clinical breast examination. All right, okay, you've learned how to do a self-breast examination monthly, but now you're supposed to have a clinical breast examination done once a year. This is a part where most women fear, but I promise you it is simple, gently, and also empowering. When you see a doctor, first things first, you don't have to wait until you feel pain or a lump before seeing a doctor. Here are key warning signs that should prompt a medical check. You find a new lump or thickened area in your breast or underarm. There's a change in your breast size, shape, or contour. You notice dimpling or puckering of the skin, any nipple discharge, nipple turning inwards or changing direction, any redness, scaling, rash on the nipple or the breast itself, persistent pain or swelling in one area of the breast. Even if you're unsure, it's better to get it checked by a doctor. All right, so what's a clinical exam? It is a physical examination of your breast performed by a trained health personnel, that is either a doctor or a nurse. It is quick, private, and usually takes less than 10 minutes. Here, what typically happens so you can feel confident and relax. What happens during the exam? Visual inspection. The clinician will ask you to sit down or stand up with your upper clothing removed and a drape covering your chest. They look at both breasts, front and side, checking for any visible difference, dimple, or nipple change. You may be asked to raise your hand or press your hand on your hips to help them see subtle skin changes. Using the fat part of their fingers, the clinician will gently feel each breast in circular motion. They will check the entire breast from the collarbone to the ribs and from the sternum to the underarm, and they'll note the size and shape and feel for any lump, whether it's soft or hard, movable or fixed, tender or painless. They may also check your armpit and the area above the collarbone for any enlarged lymph nodes. Okay? After the examination, they'll tell you if they found anything unusual. If they detect a lump or any concern, don't panic. Not all lumps are cancerous. They'll recommend an ultrasound or a mammogram depending on your age. And then, how often should you get this? Well, we'll advise that you have it once a year. Once a year is very important, especially if you are 40 and above. If you are 20 to 39, you might have it, say, once in 2-3 years. Yeah. So, but if you are 40 and above, please have it every year. This examination does not replace your imaging that should be done. So what should I expect emotionally? It's okay to feel nervous, as most people don't like hospital environments. So that is why we are doing this. But know this, the doctor's goal is not to scare you, but to protect you. You are taking responsibility for your health. That's courage, not fear. If you are shy, you can request for a female clinician, yes, or bring a trusted friend along. Never let embarrassment stop you from getting examined. Your life is worth it. All right, early detection is not just about finding disease, it's about preserving peace, confidence, and your future. So if you notice something unusual, act early. Or if you're due for your routine exam, please schedule it this month. She is clothed with strength and dignity. She can laugh at the days to come. When you care for your health, you walk in that strength and dignity. Remember, wholeness is not a dream. It is your birthright. This is Glow and Grow with Dr. Tommy. See you next time. Bye.